Next, I would request Dr. Nikhil to be introduced, please.
Yeah, thank you, Vata. I'm Dr. Amit Purwal, member scientific committee. Thank you, the whole team. I mean, we have come up with such a great webinar on good abstract and bad abstract, which is going to help all our submitters, especially for these AIC conferences. So to introduce Dr. Nikhil Balakrishnan is a consultant at Sai Eye Clinic and Crystal Vision Research Center. And he did his fellowship from Narayan Nethralaya, Bangalore. And to add to his academic activities, he won the Best Scientific Paper Award at APCRS Congress in 2019 and the Best Video at the International Video Film Festival in 2020. He also won the prestigious D.V. Chandra Bisha Award for the Best Paper in Glaucoma in the recently concluded AIC 2021. So Nikhil is a young, dynamic, ideal speaker to guide all the young submitters how to write an abstract properly. And as Somshila had rightly pointed out, a student can write an abstract in a proper way if he has done some real scientific work and he wants to showcase to the world, then he will be able to write a proper abstract. But if he wants to send an abstract to a conference so that he can get a conference leave and which is a part of his DNP curriculum or his PG curriculum, then whatever he writes, he just feels कि अगर select हो गया तो present कर देंगे, and that just creates increased burden and volume of submissions, and we the scientific committee have to bear all these poor abstracts. So in order to reduce this burden and to educate our colleagues, we have come up with this webinar. So Nikhil, over to you to brush everybody about how to write a good abstract.
Thank you, sir. Thank you, AIOS ARC, for giving me this opportunity to talk at this platform
it's
today.
AIOS Scientific Committee, Nikhil.
Sorry, AIOS.
Yeah, thank you.
Sorry for the mistake. So I'm going to be talking on good abstract, bad abstract. For any free paper presentation, the first step is to get the abstract selected. And like already discussed, the abstract is basically like a trailer for the movie. If the trailer isn't good enough, the movie, no one is interested in going ahead and seeing it. Similarly, if your abstract is not up to the mark, it's not going to get selected. And however good your study be, however good you've gone into the depths of it, you're not going to get a chance to present it. So how do you write a good abstract? This was the abstract I'd written for my paper, which won the best paper in the glaucoma session last year at AIOS 2021. Important thing first is it should have a good catchy title. It need not have a lot of fancy words, but it should clearly explain what your study is all about. One perfect line to explain what you want to get across to the audience has to be through the title. The aim of the study should be very clear. You should not beat around the bush. The exact thing that you want to get out to the audience, the most important part of the study, what is the real purpose of it, should be clearly mentioned in the purpose part. The most important thing is to write the abstract in good English. Make sure you've not made any grammatical errors or spelling mistakes in it, which puts off the reader and immediately causes him to disqualify your abstract. In the results, it's very important to mention all the statistical analysis, the actual numbers, the most important ones, as it's already been discussed here, that usually there's a word constraint or a character constraint in your abstracts. So the most important results should be mentioned in your result column with the actual numbers and the statistical analysis in that too. Conclusion is, again, it has to validate the purpose of the study. So therefore, if your study has asked a particular question, it's a question that you have put across, that what the whole study is about. The answer to it should be there in your conclusion. Only that concludes a good abstract. So as I explained, as already been discussed, that the abstract always should have titles. That means it should be very clearly mentioned the purpose, what are the methods, what are the results, and what are the conclusions. It's very important to get straight to the point, provide the most important information of your study in the abstract. Frame it from scratch. Don't copy paste bits and pieces from elsewhere, from previously written abstracts or from other papers which you are referencing. Do not use any references in an abstract. This has to be the real information what your study is all about. Don't use lines or references from other previously done studies in your abstract. Just provide a broad overview. You cannot get into every small intricacy, every small detail in an abstract because you have a word constraint. And finally, revise it once again when you're finally done with it. Format it well, do a spell check, and avoid any kind of grammatical errors. Thank you.
Thank you very much, Nikhil. And to discuss, we have Professor Pandav and Dr. Amit Purwal.
So, Partha, before Pandav sir discusses the good point of what Nikhil has already presented, as we had discussed for this webinar, I shall present two bad abstracts. I will tell them what are the bad points, and then I think Pandav sir will be in a better position to tell what was right, what is bad, and how we should go ahead. So I just begin with my slide sharing. So as discussed, I'm just going to have two slides on basically what are bad abstracts. So I'm just showing you one abstract here as we ask for a synopsis. So every conference has their own strategies, the way they want the abstract to be written. So in this case, the synopsis is written and you can see the title itself. Okay, the title should have been in a sentence case, but here everything is in capital. So this is something, I mean, I'm talking about grammar mistakes. Then coming to all the things highlighted in green. Okay, see in the title, comparison of ribbon toponometer with GAT and its correlation with CCT. Now, what is GAT? What is CCT? So we have to mention the full forms when we are writing it. If it is a standard abbreviation, it is different. Coming to the green, everywhere in the abstract, only abbreviations are written. So that is not a good way of writing an abstract. You should mention always the full form. And if the word limit is there, then you can write the short form in the bracket so that it can be used further in the abstract. Then coming to the result. So the aim is to compare the IOP readings taken by RBT ICARE with GAT and the correlation with CCT. This was the aim of the study. And what is the conclusion? RBT can be considered a reliable method of IOP measurement as compared to GAT across all ranges of CCT. Now, this is the conclusion. Whereas if you read the crux of this synopsis, when you look at the result, 400 eyes of 200 non-glaucomatous patients underwent IOP reading by RBT and GAT, and CCT was also noted. Patients with any ocular surface disorder or any posterior segment pathology and patients who were not willing were excluded. The IOP values were compared and were correlated with CCT. The mean IOP reading is mentioned, whereas there is no mention of CCT at all. So in the abstract, you have not mentioned any values of the CCT, but you are giving a conclusion. So this is one study. The other study, I am just showing another abstract of saying how it is a bad abstract. So if you see the indications and visual outcome in iris claw lens, in iris claw lens implantation in SICS, again, titles, capital, everywhere caps lock is used to mention the heading, wrong. Then mentioning the name of the institute is never done in any abstract. Most of the conferences and the publications, they don't want the center to be mentioned in the abstract. Coming to the result. When you look at the result, there are no statistics at all. So everything is just descriptive. There's no statistics. Conclusion is different than what was the aim. So what was the title given? Indication and visual outcome in iris claw lens implantation in SICS. And what is the conclusion? Alternative options like ACIOL and SFIOLs are associated with corneal decomposition and steep learning curve respectively. Iris claw lens still remains the cheap solution in posterior capsular rent in comparison to ACIOLs and SFIOLs. So you are writing one aim and your conclusion is different. So this should not be there. Then again, when you have word constraint, you are supposed to finish in 1000 characters. So now what a person does, I mean, I have been evaluating so many abstracts. I come across this, you can see the one highlighted in green. Because the character count was limited to 1000, there are no spaces left. So they have joined all the words. There is no spacing. So grammar has to be taken care. So all these things has to be taken care, and you have to write a proper abstract. You just can't just send and think that हमने तो abstract भेजा था. AIS doesn't accept our abstract at all, whereas it gets accepted in a state conference or any other conference or XYZ conference. No, everything which gets accepted has to have a quality. Without a quality, you can't think of that the abstract will get accepted. There are no influences, nothing is taken care. What speaks is the way you write and send to the scientific committee. So over to you, Pandav sir. This is just what I wanted to show. As discussed, we were supposed to present two bad abstracts so that the good and the bad part is highlighted. Otherwise, all the six presenters will be speaking the same points again and again.
Yeah, Pandav sir.
Yeah, thank you. I think that was good. So we have actually now seen both sides of the story. We have seen some excellent abstracts and excellent talks, basically, and also how to go about creating a good abstract. Something that gives you the snapshot of your work and convinces the people to read on further. I think most of the good things have already been said, and I think Amit has also shown you, some examples of abstracts which you can't really understand well, or you can't really draw conclusions which are drawn in that particular, in particular study, or they are not formatted correctly, or they're very difficult to follow through actually. So I think, but in an abstract, the most important question is, I think Dr. Pujari mentioned it, is the research question, is the purpose. So the research question should be very clear, and that should be kind of it should be relevant also to the, something should be there in that research question which is relevant to the current needs of the medical research, the community basically, but at the end of the, whatever you do, it's for the patients, for the community. So there has to be something for them directly or indirectly in that research question. And the research question has to be relevant to the needs of our own needs, the needs of the nation, and very clearly specified. So it should not be too many. So if you have, like, sometimes you have a large study which has, one purpose, and then you have it, they have some secondary objectives are also. So one main objective and then many secondary objectives. So I think, again, the focus should be on the main objective of the study. Many times when I read abstracts, a lot of time or space is actually spent on the introduction. So introduction has to be minimalistic, just one or two very relevant, the background sentences if they're required. And that's where you can save time and space when you are writing the abstracts. So once you have done a, good, when you framed your question, the research question, nicely in a properly, easily understandable terms, and writing a question, sometimes we may write in a very scientific language, which is sometimes difficult to understand. I think we always try to, even though either the some technical person or scientific person is going to read it, but still it's better to make it in a way that is easily understandable, even by a lay person. Sometimes it will not be possible, but the effort should be to make it easily understandable. And sometimes the other difficulty sometimes you find is that the components, even if it's a properly structured abstract, the components may not be easy to follow through. So there has to be a followability. So you should be able to follow from one segment to the other segment to the other segment. So that flow should be there in an abstract. And it's already mentioned that, when you are writing the material methods, so stick to, the material methods only, don't put in results there. And when you're doing the results, so put the results there, that means something, which is important to the objective, and, some statistics or some way to decide that whatever is done or whatever is being projected is authentic. So that has, the sense of authenticity has to come into the results. And they should be, as I said, they should be one should be able to follow through, and also they should be connected, or they should be in sync with each other. Because sometimes the conclusion are drawn which may not be in sync with the research question itself, or the methodology, or the results which are projected. So many times that there could be a discrepancy between different parts of the abstract. So I think that has to be avoided. So what I would say is that have a good title which attracts attention. Then your research question has to be framed properly, and it should be easily understandable as well. And then the methods, results, and the conclusion, you should be able to follow them through, and they should be in sync with each other. So many times we find that the conclusion, particularly, they are not in sync with the methodology or with the results. And many times there's a kind of an extrapolation there, which has to be avoided. So I think that's all I had to say about this. Thank you very much.
Thank you, Pandav sir. Over to you, Partha.
Thank you very much, Pandav sir.